A group of the top teaching hospitals in New York are working together to improve patient safety and quality of care. As members of the Hospital's Insurance Company program, these institutions collaborate on safety initiatives designed to reduce patient injury and improve clinical outcomes. Their latest project is using cutting-edge technology to identify patients at check-in and throughout treatment.
So for a cancer patient, they first present at the registration desk. And so we register the patient using the palm scanning system. That then links to their medical record number and their name and their date of birth. Palm Secure enables us to accurately identify those patients prior to delivering the radiation treatments. And so the radiation therapist will identify them at the consult, and they cannot proceed past the consult to receive their radiation until they've identified themselves once again. In a hospital like Mount Sinai, the benefits of palm scanning is huge because what we're able to do is we're able to mitigate the multiple medical record risk. Palm scanning is non-threatening. Fingerprints have law enforcement connotations. Retinal scanning is somewhat interventional. So palm scanning is safe, sort of user-friendly, and it's accurate. It's more accurate than fingerprinting, and it's sustainable. Your palm vein pattern doesn't change over time. Roughly 20% of all errors in radiation oncology are attributed to incorrectly identifying the patient. So with the utilization of palm scanning technology, we have eliminated that to zero. So we can safely say that using palm scanning technology is safer in radiation oncology and more effective than just asking for the patient's name and date of birth.
The hospital's insurance company, being a collaborative of our hospitals and physicians who are our clients and owners, has provided a forum for a number of different types of clinicians to get together, collaborate on special projects, things that they find difficult to do on their own. So this is what we've done in radiation oncology, and it's been successful enough that actually a number of our hospitals have decided to expand it. A few have expanded it in their cancer centers, again, where patients are coming back and forth for whether it's radiation treatments or chemotherapy or other types of visits. So now we're actually thinking about using this in other places like emergency departments, where we've been told that up to 30% of patients actually are return visitors to an emergency room for assorted reasons, and where we can again be absolutely sure that when the patient comes in, we can identify them correctly. And in many cases, some patients aren't able to identify themselves. If a patient has already been pre-entered into the system, there's a unique way of being able to scan the patient's palm and be absolutely sure that you're pulling up the right record. The hospital's insurance company, unlike other insurance companies that write malpractice policies both for hospitals and doctors, we're owned by our clients. Our collaboratives have been successful for a number of reasons, not the least of which is the leaders of our hospitals, the chief executive officer, the chief financial officers, are incredibly supportive of this type of initiative, of this collaborative. Our incentives are aligned perfectly. We're not really doing this essentially to improve a bottom line. Anything that we gain from the initiatives that we support all goes back for more nurses, for more hospital equipment to help improve care at our hospitals, and that's what makes us so unique.